The fight or flight hormone. Can you guess what it is? Hi, I'm Dr. Ina at Melmed Institute and Digestive Reset. And today we are going to talk about, you guessed it, cortisol. Cortisol is a major hormone in the body. It's our fight and flight hormone responsible for waking us up every day and the hormone associated with stress. Cortisol plays a very important role in our daily lives. And I'm a gut health practitioner and a gut health expert for so many years. And why am I talking about a hormone if I specialize in gut health? Because without stabilizing and balancing hormones, you can get to decreased inflammation. So that's why today we are going to talk about the cortisol and inflammation connection. When cortisol levels are high, it can lead to excess levels of inflammation. Symptoms of inflammation, they're not specific to a specific condition, but they typically include slow metabolism, weight gain or difficulty losing weight, irregular periods, anxiety, irritability, body aches, stiff muscles, headaches, fatigue, digestive problems, and skin breakouts. Inflammation plays a role in nearly every modern disease, such as cancer, heart disease, and all autoimmune diseases, as well as dementia, arthritis, allergies, and digestive disorders. We can't just close our eyes on recognizing the importance. And we can't just say, oh, since this is something that's involved with all these conditions, that means we can't do anything about it. Yes, we can. And it's very important to recognize it, address it, balance it, and then you decrease your chances of inflammation, even if you don't completely get rid of the issue. If you reduce your inflammation risk or inflammation in general, you will reduce symptoms, you will reduce flares, and so forth. To lower your levels of inflammation and therefore to be one step closer to healing, you must first determine how much inflammation you have. Where is it and what kind of inflammation it is if you don't particularly know, for example, your diagnosis, and what your body triggers are. Testing is an incredibly important. So this is where the testing comes in. Functional medicine testing can be can give you significant advantage in the treatment or a wellness plan of chronic conditions, harmful ones. However, there could be a problem. In addition to testing your cortisol levels through whether saliva testing or whichever, maybe even blood test that you've done, it can also be inconsistent. For example, it could give you that particular level for that particular moment. We want to get a little more than that. So you also want to get the testing for your inflammatory responses, for the inflammation markers. So here are 4 inflammation markers you should ask your physician, your primary care, or your nurse practitioner to do it regularly for you and have a good baseline and continue following up. Number 1, C-reactive protein test, CRP. CRP is a blood test that determines how much inflammation is present in your body. Ideally, you want to have less than 1 milligram per liter on this test. Number 2, liver function tests. This test determines the extent of liver damage caused by insulin resistance, insulin resistance induced inflammation. High liver enzyme test usually equates to liver cell death, which is most commonly caused by elevated insulin resistance due to a fatty liver. And that we'll cover on a different day. Number 3, fibrinogen test. This is something I recommend to many of my clients, especially the ones that have issues with clotting in the family. That's often hereditary. So fibrinogen is a type of blood clotting agent that rises in response to inflammation and insulin resistance For this test, you ideally want to get less than 350 milligrams per deciliter. Number 4, ferritin test. This is a metric for extra iron storage, which rises in conjunction with inflammation and insulin resistance. Lower than 200 nanograms per milliliter is ideal for this test. How to reduce inflammation? If you suspect excess inflammation in your body, and it's extremely necessary, it's extremely important to decrease the stress and support the body, and not just with stress reduction techniques. You could do that with following steps. Get enough quality sleep. Sleep is huge. Sleep is when your body rests and repairs itself. It's perhaps the number one thing to work on when dealing with stress and inflammation. Stop eating processed foods and drinking coffee the entire day. It can lead to fatigue, sugar crashes, and excess inflammation. Focus on vegetables, fruit, lean protein, lean clean protein, and healthy fats throughout the day to keep you energized the whole day by supporting healthy cortisol levels. Stress reduction techniques, of course, they work, but you could also use aromatherapy, nice essential oils to decrease the stress and improve quality of sleep. Lavender has a great study that supports improving good and getting you more quality sleep. If you're suffering for adrenal fatigue, if you've been already tested, you could reduce the symptoms of stress with adaptogenic herbs, properly selected for you, for your type, for your testing results. Ashwagandha has some great results according to some recent studies, and I often use the recommended for my clients in my practice. Developing a personalized plan is a game changer for my clients. And that's why I highly recommend to do the right kind of testing for you and the right kind of wellness plan to address it and decrease the risks and decrease the effects of inflammation in your body. If you like this information, if you find it helpful, please share, please follow. This is Dr. Ina, your functional medicine pharmacist at Digestive Reset and Melamed Institute. Please subscribe to my newsletter. The link is going to be down below.